All right, so moving on to our next motion, we're going to be taking a look at what we call shoulder abduction, which is essentially this movement here where we're reaching up and away from our body in an arc, almost like we're making a one-armed snow angel. So again, you want to make sure that your friend or family member is as far over as they can possibly be on your table, your couch, your bed, whatever is most handy for you to be able to work on stretching out their shoulder. So again, you want to get into a position to where you're going to be starting off with a little bit of a squat, helps to protect your back, helps you to cradle their arm effectively. You're going to start to bring them up again to about chest height, and then again you're going to reposition that bottom arm that's furthest away from the head to where the fingers are going to be facing up towards the head of the bed, towards the head of your friend or family member. Now the difference here is that we're going to start to swing that arm out and away from the body versus in the last one where we're working kind of directly up and towards the ear. So again, visualize that one arm snow angel, and we're going to again start to work slowly, kind of in a rhythmic fashion, doing a little bit of back and forth as we go, just trying to give that patient, that friend or family member, as much support as possible so that they're able to relax the muscles around their shoulder. And it is helpful to get their feedback as you go along. So if they're telling you something's hurting, if you feels like you need to reposition slightly, it's okay to bring the arm a little bit further up towards the body, and so it's not quite as aggressive of an angle from there. And you want to work up again to where it starts to get a little bit tight, maybe a little bit sore in that range of movement. And you're not going to really try and crank past that, but you're just going to work up to that point, kind of move back and forth gently within that range for a minute or two until it starts to stretch out and may allow for you to do a little bit more movement from there. Okay, so after your minute or two is done, you're going to start to gently bring them back down from there. Again, reposition that arm that's furthest away from their head to where now it's underneath and cradling the arm at the elbow. And then you can bring their hand down towards the table or towards their body to support it fully from there.